Testing. Testing 1 2 3. Testing 1 2 3. Testing 1 2 3.
Mic check. Mic check. Yeah.
Testing. 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 Testing 1 2 3.
Mic test 1 2. Testing. Right. Have we gone live? Yeah. Okay. Good evening, everyone. I think it's a bit too loud. Can you slower? All right. Thank you very much for coming to Penang Institute today on a very peaceful day when there's no rain, good sun, just nice. I hope you have a very safe travel to Penang Institute. Today we are talking about Vision Zero, improving road safety for better public health. I am Xiaowun and I'm from Penang Institute. Once again, welcome to Penang Institute. Today we are doing this, our second public health forum series together with the Wu Day Society. Without further ado, I would like to invite Dr. Sri Anna Faisal, the president of the Wu Day Society, to share a welcoming remarks.
Good afternoon. Assalamualaikum. Peace be on you. Thank you so much for coming to this very special occasion. How many of you have heard of Dr. Wu Day before? He was a very interesting Penang. We're talking about somebody 100 years ago. he was the best student every year in Cambridge in the UK. He was a graduate of the Penang Free School, the oldest school in this part of the world. And when he came back, although he was the best student, he could not be appointed as a doctor. He could only be appointed as an assistant doctor. Why? Only Europeans would be called doctors. Others would have to be only assistants. Although he was the most qualified person in the whole country in terms of the top student. If you wanted to go up Penang Hill, Europeans only in the coach. Others, very interesting. And United Kingdom had banned opium. Opium was a very big business one time. And although it was banned then, British colonial government in Penang was still selling opium. And opium was the single largest revenue of the state government of Penang. Amazing, isn't it? Yeah? Amazing. So he started the anti-racism society to fight against the Europeans. Then he started the anti-opium society to fight against the fact that opium was being sold. The people of Penang are being grabbed, by the time one talk about drug addicts. Can you imagine? And drug addiction is a state enterprise. And the more people that get drugged, the more money the state gets. How ridiculous is that? He fought. And because he was a strong fighter against the colonial government, they made his life miserable here. And he went, as a result of that, he got an invitation to go to China by the Emperor of China, who had heard that he was the most authoritative figure on infectious diseases. And they were then having a pandemic. And the pandemic, hundreds and thousands of people were dying. And they were not able to trace the reason why we had COVID. But can you imagine an infectious disease that was killing thousands of people? And a German doctor had wrongly diagnosed it as the bubonic plague, when actually it was the pneumonic plague. It spread from the air to people. And thousands of people were dying, their bodies were lying all over the place. And so when he went there, he said the first thing we have to do is that we have to burn all the bodies. To burn all the bodies. And they said, no, under Chinese culture, you cannot burn the body at that time. Yeah? You burn a body means you are sending them to hell. He wrote to the emperor. He wrote to the emperor and said that if you do not burn all the bodies, do not cremate them, the flies will be always on the dead bodies, and the flies and other insects will spread, and the whole of China will be destroyed. Imagine a health issue of that magnitude. Yeah? So the emperor said, you have my support, and the bodies were all cremated properly, and people were told to wear a mask. So the current mask, see 1, 2, 3 persons wearing. The creator of this mask was Dr. Wu Lien-teh. It was straight up called the Wu Lien-teh mask because he felt that if people don't protect their mouth, they will be infected. So he did that. That was a very remarkable achievement because once the cremation and the mask were worn, the disease just like disappeared. So he was that kind of hero. And we decided that hero like that is often forgotten. And that we decided to resuscitate his memory, resuscitate the struggle that he had against colonial government, against very fundamental things that they were actually deliberately like destroying us and treating us as inferior. And he did it. He went to China. After he succeeded, the Chinese government was so pleased. He did not want to come back because the colonial government was still running Penang. He stayed in China. He set up 20 maternity hospitals, general hospitals in China all over because they didn't have kind of modern hospital. He set up the Chinese Medical Association. The Chinese Medical Association now has 500,000 members. The largest medical association in the world. So here was Penang, what we call Penang in the local language, who actually transformed the health architecture of the world. He hosted a number of World Health Organization meetings, and these meetings were attended by people all over the world. And when he returned, he did not come to Penang, he went to Ipoh. He started a small clinic where he served like such a humble person like he was. And when the Japanese occupation occurred, because he was still selling clinic, some people bought the medicines and they were seen to give to some kampong people. And the Japanese thought they were giving it to the communists. And so they arrested him, saying that he actually was just serving medicine to whoever wanted. And he was taken up. And then the Japanese commander in Ipoh read the name, and he recognized who this person was. That this was a world person, world authority. Called him and told him, "You never worry. Please keep on the good work you are doing in this country." And after some time, he came over back to Penang when we were independent and stayed here. And he passed away in Penang. He's buried in the cemetery in Penang. So this hero was one of the greatest persons who talked about health safety. Health safety that actually made a difference to the world. And over the years, if we look at different kinds of pandemics, accidents by death, by road issues, have actually grown and again too often ignored from many different aspects. It was about 20 years ago when I was working in the United Nations in Kuala Lumpur, and head of the urban governance program for this area. I discovered that more people were dying from accidents than all the people who had died in world wars during this particular century. More people were dying from this. So we always learn about wars, but who cares about road safety? So today we decided, as part of the series of lectures on health issues, there's a very special lecture in connection with, together in partnership with the big city itself, with the Penang Institute. Penang Institute, as you know, is a think tank, state government. It does amazing amount of work on every aspect of Penang. One day maybe they will even have a special issue on the history of the police force in Penang, which will be very interesting. I had a book on all the manual on how policemen should behave. It is written in 4 languages: Chinese, Punjabi, with a lot of Indians, Tamil, and Malay. Yeah, 4. And this was given to every policeman on how you must be civil, you must be kind, you must know your work, and then you must tell people what is right, what is wrong. It was amazing. I gave this to my colleague, Suhaili, when he was here as CBO. And he was just amazed because he had not seen, wow, such a manual that would be there. So to share the views, we have 3 very unusual persons who are going to share the truth about what's happening and what we can do. The first speaker is Dr. Krishnan Rajan, who's a public health specialist. He's worked in different places. He's actually got all the real experience, grassroots experience, you can say, about injury prevention. He's a lecturer and professor, University of Malaya, my alumni, and also RUMC, from which I just came. We are doing a project together with them on family health issues. It's written for the Lancet, which is like #1 magazine with regard to health issue. Amherst University, as you know, is in Penang. A lot of their students come from this particular region itself. So the second speaker will be Nor Assyrian, Nor Aslan. And he's with the Majlis Bandaraya, the enforcement division. I have been quite well behaved. I only had 2 coupons from you. In that for illegal parking. Had my car once towed away. Happened to be parked on a Sunday at Bothwell, where the go-downs are. Normally on Sunday, nobody parks there, nobody goes there, and there used to be parking allowed. And there was a festa on Beach Street, and I was asked to speak. So when I came, I couldn't find a place nearby. I found that place, and I just left my car there. And when the whole thing finished, I couldn't see my house, only car parked there. And I thought, I had forgotten where I parked my car. Then I asked somebody, kata merah, anda, 25 anda. And he said, oh, itu kan, police my okay. So I had a nice experience then of learning how to go to the special office that you have behind Times Square. And managed to pay the fine. I think it was 300 or 500. I can't remember. And managed to, like, how much? 200? 100. Now 100. Maybe that time it was more. Much more. Maybe they go on the cars, small cars. And so we got it back. It was a good experience because we learned, and more recently I actually reported cars that are not parked properly and quite irresponsible, especially when you have junctions and so on. One particular one is near an island hospital. I used to work in the Majlis Bandaraya also many years, from 1965. And I was sulit to the chief minister at that time, Lim Chong Yu at that particular time. So I could really engage very, very closely. So that would be the second speaker. And the third one, extremely important, the part of Penang that very often people ignore. Look to point as a backyard. You're from Penang. No, I'm from Seberang Pride. So sometimes people make a distinction when they say that Seberang Pride, in economic terms, in terms of history, heritage, ecology, the fact that many roads leading up to every part, the main port of Penang, the railway, the archaeological Cherokupun stone, and the fact that 2 prime ministers come from Seberang. But Davi was my classmate at university there, and to see Ibrahim, I also worked on a number of issues. And so we have somebody there who also experienced Karak. I was born in Karak, very familiar with all the different kinds of roads and the issues that we have. So with that, it gives me great pleasure to invite the first speaker, Senior Professor Dr. Krishnan Rajan, to come and address this.
Thank you, Mr. So, can you hear me? Can you hear me back? Essentially, today I want to ask some questions, some very basic questions along the way, and then we can see how we can answer them towards the end. And the sources of my data is given here. And I hope to present briefly on the magnitude of the problem of road traffic injuries in Malaysia. What are the institutional arrangements? What are the issues with our data system and our models? And our interventions essentially evidence-based, and some recommendations at the end. I'm sure you all are aware that Malaysia has one of the highest rates of road fatalities in the world, and this was according to the PIN study, which was published in the local media. And this obviously is due to a rising vehicle population, and we have one of the highest vehicle population density in Asia. If you look at it for 1,000 residents, and this number is increasing, and I will emphasize this again later. So the number of fatalities in Malaysia, I'm sure you all are familiar with the rough figure of 6,000 to 7,000 fatalities a year, and this has been pretty consistent. Of course, there has been a decline, somewhat decline in a few years ago, in 2019, but all of you should remember that currently we are at 6,500 or so. So we are somewhere here. So there is perhaps an increase or decrease, depends on how long or how far back one looks at this data. And most of you are familiar that motorcycles form 67% or 65%, depending on the year, of the total number of road fatalities. So this is something all of you are familiar with. But what surprised me most was a few years ago, Prof. Fahan from USM, who's now the VC in UPN, Prof. Dato Fahan, shared this slide with me. And in Penang, I think the police data will tell us that roughly 75% of road fatalities are due to motorcycles. In other words, much higher than the national proportion. And the reason for this is the higher number of motorcycles per kilometer of road per square mile land area. In other words, the motorcycle density in Penang is very high. Okay? And I don't like my Penang, I don't like my own Camry because it's too big. I would have honestly liked a smaller car. So what are the institutional arrangements for road safety in Malaysia? Some of you are familiar, but let me just touch on some of these. We have a cabinet committee on road safety, which was set up after the major Karak highway crash. This was clearly about 3 decades ago. And in response to that, we have a cabinet committee chaired by the PM or DPM, and it meets after major crashes. I think it should meet more often, and it discusses action by the various ministries. We have a Road Safety Council of Malaysia, MKJR. Some of you might have heard of this terminology. Started more than 50 years ago. It's a forum actually consisting of government, private, and NGOs to discuss common issues. I used to attend all the meetings those years, and all I remember is the vase which I got as a token of souvenir for presentation of a paper. This is nearly 25 years ago in Sarawak. Okay, I still have it in my house. I keep my umbrellas there. That's the only thing we hear about MKJR nowadays. Okay. It had various committees, but I was a member of the research committee long ago. So there's been no meeting for about 4 to 5 years now. they have a Facebook page, and I think the Road Safety Council has a role to play to bring the different sectors together to discuss emerging issues and solutions and interventions. That's probably the best way, best existing mechanism to discuss road safety, because the mechanism exists. This is very interesting, the Road Safety Department, because I've traced it over 3 decades. The land division in the Ministry of Transport, Bahagian Darat, took charge of road safety. So Bahagian Darat was in charge of road safety. Then it became Bahagian Keselamatan Jalan Raya. Then the Bahagian Keselamatan Jalan Raya became a department, a separate department in the MOT. Then they started branches all over the country, each branch with an office in the capital. I think there were a few cars and big cars and offices in every state. For some reason, I think we all can guess, the department was merged into JPJ a few years ago. Obviously, not an effective structure. No country in the world has a road safety department in every state. We had it at one point in time. But we are learning from our mistakes. We hope we do. MIROS is perhaps the only existing structure, in addition to JPJ, of course, with due respects to JPJ. So they address the research aspects of road safety, which is very important. I grew up as a researcher, in the University of Malaya, and the total money of research I would have done, maybe the government gave me about a few 100,000 ringgit worth of money from about 95 to 2005, perhaps. So over 10 years, I would have got a few 100,000 ringgit. But that gave me enough experience, enough knowledge that I could work for the World Health Organization in Manila for 5 years, helping governments, advising governments on road safety for the whole region. So the few 100,000 ringgit investment in me, research, has a trade-off, and I still continue in some small ways to road safety in Malaysia, and I hope to do so. So MIROS, the only issue is that once MIROS was set up, the funding for the universities decreased. So now if the university applies for research in road safety, they say no, collaborate with MIROS. So the capacity in the universities, which brings up new doctors, has diminished. So there are pros and cons of setting up an independent road safety institute versus having a few universities being interested in road safety research. If you put them all in one place, the universities are literally starved of research funding. And so the newer generation ought to be developed. I know that MIROS works with a number of universities in their courses. I know that, for example, University of Malaya, they do that. But this is one of the drawbacks of this structure. Ideally, you should have both working. They do work. I know that MIROS does collaborate, but probably we can do much better than that. And MIROS actually should be transformed into a National Transportation Safety Research Institute, or perhaps even better, a National Transportation Safety Board, which some of the highly developed countries have, looking after transportation safety in every sector. Okay, now that I've told you about the data, what are the issues with our data and our models? I'll talk about deaths per 10,000 vehicles, the issue with that, the number of serious road traffic injuries which will interest the police, and models. What are the issues with models? Okay, I'll address all three. As mentioned earlier, we have a significant increase in the number of vehicles every year, and I'm sure the statistics will go beyond this. Our fatalities, as I told you, somewhere here, but they were somewhere here by now. They're probably somewhere 6,400 here. So the number of, remember this, the number of road vehicles is increasing. And therefore, the number of deaths per vehicles as per the MOT website is also on the decline. The number of road deaths has remained pretty much the same, but the number of vehicles has gone up exponentially, perhaps, and therefore the number of deaths per denominator per vehicles is declining. And this is seen on the MOT website. So should we use this as an indicator? We should not. And sometimes this is taken from the Road Safety Master Plan. This was target for 2010. And they have set this as a target. Well, ideally, WHO says you should keep this as your target. Again, all of us are traveling more and more, so the number of deaths per billion kilometers traveled will also decline. Sometimes models are used based on the fatalities for 10,000 vehicles. I already told you that this decline is due to the increasing number of vehicles. You cannot use this to model interventions and their effectiveness. And I'm sorry I cannot trace the origin of this slide, but I think it's one of the researchers in Malaysia. For as long as I know, Dato Ling Leong Sik or Tun Ling Leong Sik has been the transport minister. I've been working with him and his deputy Zaleha. For those of us who are old enough will know, she was for eternity the deputy minister for transport. And I've been saying this for eternity, that we should not use deaths per 10,000 vehicles. We should use deaths per 100,000 population. So this is a paper cutting from perhaps 25, 30 years ago. Okay, now let's look at police statistics. These are police statistics and shows you that the number of fatalities, okay, slightly gone up, and then come down, and then perhaps gone up. But the number of serious injuries in Malaysia, according to official statistics, is coming down. And the number of minor injuries is also coming down. Obviously, if the deaths are increasing, you would expect this to go up as well. WHO says the proportion of deaths to serious fatalities to minor injuries is about 1:17 serious fatalities to about 61, depending on what you consider minor and serious. So the police are underreporting serious and minor injuries. Why are they underreporting? I did a consultancy for the Royal Malaysia Police and Department of Road Safety about 20 years ago. And I spent 5 months in the police station in Petaling Jaya. I was in UM that time, not in the police station. Literally, I spent days there looking at how they investigate crashes. The police don't have time to investigate all the increasing number of crashes we have in Malaysia. They don't have time. So I recommend that they actually omit serious and minor injuries. It's okay. Let them spend more of their time on the field enforcing our laws. They don't even need to investigate those minor injuries. There are issues with interventions and the evaluation, but that's another matter. So it's a fact. What I'm saying is a fact that they don't have time to investigate serious crashes and minor crashes. They have a 24-hour, 48-hour deadline. The investigating officer has to enter the data into the police system. Otherwise, it gets locked and his senior has to unlock the system. It's not a nice thing to tell your senior, I had 5 crashes and I could not investigate. Am I right? He's nodding the head, so I guess it's correct. So the police can actually publish their raw data on the web. We used to have a police book every year. Those years, till 10 years ago, the police had an annual report. They don't have this. That's fine. Less work for the police is good for us, because then they can spend the time enforcing. They just need to publish the data on the web, perhaps. The next issue which I face personally is regression to the mean. Now, many of you are not statisticians, but I just want to tell you what is regression to the mean. If you know what stock markets are, roughly, you will understand what regression to the mean is. If something goes up, it will come down. Okay, if the stock market goes up, it comes down, because this is a rough range. So this is roughly the mean. We cannot say that if we intervene at this particular point in time, it has come down, or we cannot take credit for that. So maybe we cannot take credit for the decline in road safety a few years ago, which I showed you. Maybe for the same reason, we cannot take credit. It's just the natural history that it goes like that, and comes down like that, and then goes like that, and then perhaps like that. So that's the natural trend. Okay, so you must understand this concept. Very important. So our target is to reduce number of fatalities. All of you are aware of that. And we have set a 50% target by 2030, which is barely 5.5 years away. 5 years and 3 months perhaps. 6 years perhaps. And from what level is my issue? A 50% reduction from what? Is my question to everybody. I need to take a minute or two of your time. Please understand this. This is modeling. This is high statistics, very high level statistics, which I don't know anything about. But I need you to understand the basic principles of how this is done. So this is deaths which occur over a period of time. And then the model, statisticians and researchers in the past have said, oh, if you leave this unattended, it will reach 10,000. What is this? 9,000. It will reach 9,000 in the year 2000. It will reach 9,000. So if we don't do anything, it will be 9,000. If we do something, it will be here. Okay? So researchers told us that if you don't do anything, it's like frightening you, frightening us. The model has said that. So is that right or wrong? I leave it to your own interpretation, because I'm not a statistician. But they told us it will be 9,000 in the year 2000. It was not. So many people took credit for this and said, no, we did something, because it is now come down. So my question is, the original itself, it could have been like that, isn't it? That's what I told you. That's what the normal structure would be. So I have an issue with this. I don't know whether people in Miros who are listening or not listening have an issue. I personally have an issue with it. And so they talk about new trends. So the new trend, we did something, and therefore this is less than that. These are statisticians from renowned universities whom I know, who are associate professors and professors. And so this is exactly what I said. So they say, this is a forecast. Now I told you forecast for 2000. This is a forecast for 2020. All taken from our Malaysian road safety master plan, which is now, which is the current plan. But these are all examples given in that particular document. So the 2020 said, no, it will go up to 10,000. Very good. Malaysia is doing very good, because it's not 10,000 in the year 2020. It's only 5,000. So let's celebrate. There's no need for this webinar actually, because we are doing very well. Can you see the fallacy in my argument? Now the other way around. Earlier we said it's going to be 10,000. Now we are at 6,000. So we are okay. Not too bad. Now, according to the road safety master plan, from the road safety master, our 2030 target, now the other way around. I'm sorry, because of the decline in the few years ago, they thought, whoever wrote this document, I'm sorry, they thought it's going to go down forever. And the target for 2030 is 3,000 fatalities. I keep reminding ourselves of this figure. That's why I put this slide here. But even at 2023, we are already here at 6,000. So are we setting realistic targets? Whose heads will roll after 5 years? Nobody's head, somebody said. So those are the issues I have. Okay, are our interventions evidence-based? How many minutes do I have? I'm sorry, I lost track. 5 minutes. Are our interventions evidence-based? There are many things which work in road safety, which has worked all over the world. Drink driving laws, helmets, seat belts, speed reduction, many things work. We know that. And some things don't work. And I'll come back to this later. So in Malaysia, we had media campaigns. Let me give you one example of one research project I did. I have to be very fast. I saw a lady with post-mortem photograph who had strap marks here. So obviously, she was wearing the helmet and she died. So she either did not strap it correctly or the quality of the helmet was poor. So we investigated helmet use all over the country. And we found that a lot of people don't either fasten it loose or unstrap it or don't wear helmets at all. That was in urban area. In the rural area, some don't wear helmets and many don't fasten it or just leave it loose. Obviously, this lady wore the helmet. So the problem is maybe the helmet was poor quality, and I'll come back to that in a subsequent slide. So this is an example of what I said earlier, and this is loose. And this is research which we did throughout in Kulim because my research assistant was based there, and we studied thousands of motorcyclists. And so the government came up with campaigns. Ikat, jangan tak ikat. How many of you remember that particular poster? Some of you remember it. Huh? Ikat, jangan tak ikat. Campaigns. And then we studied helmet use in Kulim again before the campaign and after the campaign and found no difference. Campaigns don't work, and our minister has recently realized that campaigns don't work. And that's what the evidence shows. The evidence shows that campaigns don't work because you have to combine campaigns with enforcement. Education, we think, works. Let's see what happened, what the evidence is. This is a efficacy of road safety education in schools from the University of Adelaide, published almost 13 years ago. And it tells us that there is little evidence or lack of evidence showing that it does not. The effectiveness of current road safety education programs remains largely undetermined. Okay, and this is another recent review. It shows that driver education there's no evidence that it's an effective approach, even though we all think it's a good idea. And this is for motorcycle rider training, and it is not clear if it reduces the risk of crashes. If you take a small group of children and try to teach them how to cross the road with labor-intensive stuff and showing them a lot of videos, their road crossing behavior improves a little bit. Can you do it for the whole country, all the children in all the schools? Probably not. So the US government, based on a UK research study showed that the US government said, we cannot implement this in the large population, even though it has some benefit. So teaching children to cross roads does not help. This is taken from the Road Safety Master Plan of Malaysia for motorcycle safety. And I can't find the word helmet in this place. Of course, they say enforce the law. But the helmet, 67% of our fatalities are motorcycles, and WHO says helmets are 50% effective, and I can't find the word helmet here, nor quality of the word. Why is quality of the helmets important? Because we did some helmet research many years ago, bought some helmets, sent it to the to Sirim for testing as part of my research, and found that majority of them did not pass. Some of them, the manufacturers were doing illegal practices. We did the same thing 10 years later, and we found that this time it was better. The children's helmet were, however, lacking. So this time the government implemented standards for children's helmet as well. And recently as a few months ago, my students and I bought some helmets from the market, both bicycle and motorcycle, and found that majority of them still don't meet standards. And our master plan doesn't have the word quality or helmet. So what are the some recommendations? I'll just take 2 more minutes. Okay, we still think that road safety is a human behavioral problem. Of course it is, but it must be viewed in the context of a safe systems approach. The safe systems approach minimizes mistakes and takes into account the mistakes which we do. If I am involved in a crash, I want to be in a safe car. I want to be wearing helmets. I want airbags. I want an emergency response system. I should be ideally traveling in a low speed. So even if I'm involved in a crash, I don't want to be injured. Okay, so a safe system approach, instead of blaming individuals, has interventions everywhere along the way for motorcycle safety. Road safety is a whole of government approach. You need safe vehicles, safe roads, enforcement, trauma care, but the most important is land use policies and public transportation. In Singapore, every high-rise has its own shopping complex, minimizing transportation needs of families, and they have an effective public transport system. So land use planning means houses, schools, offices, factories, and an effective public transport system connecting homes to offices and to factories. One more minute. We all remember this crash involving many bicyclists. Okay, 8 deaths. The law needs to be reviewed because the law is a little subjective. And finally, the lady was acquitted by the highest court. And the law is very subjective and blames individuals without giving due respect. Sorry, where am I going? We'll go back a bit. To the circumstances of the road. Okay? So enforcement works. This particular country, okay, in Germany had 1 day speed limit enforcement, just 1 day. They said we'll implement speed limits, and they benefited around 8% just by 1 day increasing speed limits throughout the country. So what I would recommend is we should take speed, helmets, seat belts, all the low-hanging fruits of road safety, increase the perception of being caught, okay, enforce throughout the state, day, night, and police should be visible enforcement, also overt and both overt and forward enforcement. That's my recommendation. My final slide. I don't think we learned enough from our experience from what I've presented. We are not learned enough, or we are learning too late. So research is still important. MIROS has its role, perhaps can play an even bigger role. And should road safety be completely handed over to the police? That's a question which I'd like to ask. With that, I stop. I've taken about 2-3 minutes. That's all I have.
Thank you, Dr. Krishnan. So next, we would like to invite Tuan Azrin, who is the director of the enforcement department in MBPP, to give his discussion. Right. Right.